enjoy going to church in person. But as the rate of transmission increases, as we get closer and closer to overwhelming our healthcare system, we have to act in a more protective way. And that means if you have the option of tuning in from home to those church services, my advice would be to do that now and to take other protective actions so that we can slow the spread, we can avoid overwhelming our hospital system, and we can avoid having to make the recommendation to the governor to go back to a shelter in place. And with that, I'll turn it back over to you.
Thank you. Now to our poll reporter, Austin Sanderson from the Austin Chronicle.
Hi, this is Austin Sanders with the Chronicle. So first, I want to ask about some of the outreach efforts to vulnerable communities, especially Latinx and Black Austinites, where disparate rates of infections and hospitalizations are seen. So what kind of outreach is being done to make sure people are getting tested, know about isolation options, and are taking advantage of other resources like the hotel rooms? And how are you measuring, the success of these outreach efforts, and what are the results thus far?
You're on mute.
Hello. We are seeing we are seeing an increase in the number of individuals that are coming in for testing in the Latinx and African American communities. It has been very important for us early on. We established a social services branch. That social services branch has either been City of Austin staff and or our partners. And those partners have provided information about testing, about the isolation facility, about the importance of ensuring that you get a test and any of your contacts get a test as well. And so we know that we are seeing those increases by the individuals that are coming in, but we're also seeing the increase by the number of people that are testing positive. One of the other things that is really important for us is to ensure that our staff and our partners that we contract with, as they are providing additional outreach and information to our community, it's making sure that they know all of the risks that are associated. So if an individual is taking a test, our recommendation is that they should assume that they are positive until they receive notification from us that says that they are not. We don't want them to go to work. We have used the RISE program with several of our partners, and we have been able to provide financial assistance working through over 40 nonprofit partners through our community. And through those efforts, a significant amount of the funding has gone to the Latinx and African American communities. And we feel very confident that that process is working well. However, we are open to communication from our partners to let us know if there are areas. We have established 3 community sites. 2 of them were open yesterday, and we're really feeling good about those sites, and we will continue to provide that testing in those communities.
Okay, thank you. The next question is from Report Day Austin. They say, asymptomatic people who tested positive in the last few weeks are being denied a new test to see if they have fully recovered. Some companies are requiring a negative result so they can go back to work. Are you planning to include them for new tests in the near future?
So we do not support the 2 negative testing or 3 negative testing strategy for clearance of individuals. The CDC also recommends a time-based clearance. And quite frankly, we do not have the capacity in the labs to test everybody multiple times to prove negativity. There is a lot of value in the clinical clearance, the time-based clearance, and we are supporting that effort in our community. Certainly, if employers want to have a negative testing strategy for clearance of individuals, they can work with private labs and offer free testing for their employees if they're going to require that for return to work.
Okay, our next question is from Estonia. They ask, Mayor Adler said Austin is competing for testing supplies and lab results because of increased demand statewide. How is this affecting testing capacity at Austin Public Health and other sites? Is it getting worse, better, or holding steady?
So the lag time in test results is holding steady and perhaps getting a bit worse. Just on community care's tests from the past couple of weeks, they're still waiting on 2,000 test results, and they have a very small percentage of those that have resulted already. And this is what I was talking about yesterday in terms of not being too comfortable with the fact that we saw a decrease in positive tests over the weekend. We are missing thousands of results. So it's really difficult for us to tell if things are getting better or not, because we're not getting the turnaround times that we used to. We used to get turnaround times in the neighborhood of 2 to 3 days. Now it's 7 to 10 days, sometimes longer than that. So we are competing. And as Director Hayden said earlier, we don't want people to wait on a test to take action. It's COVID-19 season right now in Texas. If you have symptoms of COVID-19 during COVID-19 season, which we're in, you have to assume that you have COVID-19 and take those protective actions to reduce the risk of transmission to family, to friends, and to the rest of the community.
Okay, thank you. Our next question is kind of a follow-up on that from KVUE. So can you just kind of provide more of an update on testing? Like what is how long is the wait time now from getting a test to when someone can expect a result?
Again, there's substantial variability based upon who's doing the testing and which labs those are being sent to. We have a great partnership with a lab called AIT, and we usually get results in about 2 days. The nice thing about that is the test results are automated, so individuals are notified via email or text that they have a result as soon as that result comes out. So in that system, we're not relying on a fax coming in to receive the results. We get them relatively instantly. But for other labs, particularly the national labs such as Quest and LabCorp, we're seeing 7 to 10 day turnaround times. Yesterday, as an example, at one time we received 289 results from one of those major labs, and those tests were done around June the 26th. So 11 days between when the person was tested and when Austin Public Health received the results of those tests. At that stage, the test results are relatively useless for us, because the purpose of the testing is to identify the contacts, to isolate the positive person, their contacts, get their contacts tested, to box it in. But if we're getting results after the person is no longer infectious, that strategy doesn't work, which is why we need people to take protective action when they become symptomatic. We need people to utilize crowdsourcing for notification of their contacts. So if you develop symptoms of COVID-19, it's important for you to contact those who you know you were in close proximity to during the 48 hours before you develop symptoms, and let them know that they need to protect themselves, they need to isolate themselves, so that we can break this cycle of transmission.
Okay, thank you. The next question is from KOP Radio. Schools are set to open next month regardless of what stage public health sets for the city of Austin. Is APH advising local school boards? If so, what is your advice on reopening? What advice do you have for parents, students, teachers, administrators, and support staff?
So we've been in regular contact with the area superintendents for more than a month now regarding plans for reopening. Of course, much of the direction comes from the TEA as well as their school boards regarding the individual school districts and how they will proceed. I do support the concept of offering an option for in-person and for virtual. We have to realize that right now the statistics support the concept that school-age children are less severely impacted, generally speaking, from COVID-19. But there are going to be some children and there are going to be some households that are going to be higher risk. We're going to have faculty and staff who are going to be at higher risk for complications, including hospitalization and death. So the plans have to allow for some flexibility to allow parents and employees to make decisions based upon their individual risk. I will say that I know there's a lot of controversy about masking and having school children wear masks. I was happy to see that TEA made that mandate. I think similar to the discussion we have with keeping businesses open, if we don't have masking in schools, we are losing the most effective way right now for us to keep schools open. So masking is important. I know it's going to be a change in culture for students, but it's a culture they'll adapt to. And I'm hopeful that the school districts will enforce that and that we can all work together to open schools and keep them open.
One thing I would like to add is that this summer, with all of the athletics and band camps that are going on, we have received several calls before they establish those camps, and we have continued to provide technical assistance to them about how to safely do those camps. Because it's important for us during this entire time, as Dr. Escott has said, is that we have been in touch with several school board staff from several districts during this time. And so it's important that we make sure that even the staff, as they are transitioning and looking at ways of how they can make the necessary improvements to move forward in a summer with athletic programs or cheerleading programs or any other types of programs where they may be bringing folks in to actually have that interaction. In addition to that, we've talked with them about their graduation efforts. They've reached out to us as well. So during this entire time, and we will continue to do so because there's so much uncertainty with COVID-19, we will make ourselves available to provide that technical assistance even after the school year has begun.
All right, thank you. The next question is from Univision. A few weeks ago, APH announced the creation of a special task force to help the Latino community tackle the coronavirus. We have been given weekly updates as far as what this group is doing to assist in educating our community. We also learned of spaces that will allow for people to isolate themselves. PSAs were made. Nonetheless, the Hispanics in hospitals are still leading the charts, and unfortunately, 41% of the deaths in Austin. Is the task force meeting weekly? Are they changing their strategies, seeing that the numbers are changing? Please give us an update on the work this group is doing.
The internal group that was established on June the 11th, at the time, the acting assistant director, Adrian Stirrup, provided some information to our mayor and council about the overall plan to address COVID-19 response for our communities of color. And so there have been several things that we have done. One, we've had a Saturday meeting with the Latinx population to receive information from them about aspects of the response, which will be important for us to provide in the response. And so as a result of that, a small team of individuals from Austin Public Health, Community Care, and Dale Med UT have taken the response from Adrian Stirrup and have come up with another document and come up with a working plan. That working plan, we've sent that out to some partners over the weekend. We are going to provide the information to our mayor and elected officials later on this afternoon. That document will be posted on our website. And our hope is that based upon the additional information in that plan, we will go ahead based upon feedback that we receive from the community, that we will in turn continue to do more efforts. So we know we need to increase the level of the efforts that we have started thus far, but we also want to do more. So that is forthcoming.
Okay, thank you. Next question is from the Austin Business Journal. In reference to the discussion at Commissioner's Court yesterday, what is the update from UT regarding the trajectory of hospitalizations that could indicate the need for a stage 5 recommendation? How will that trajectory be measured or sized up?
So basically, we're meeting with UT at noon today, along with other stakeholders, and they will provide us with an updated model looking at the data from the last week to determine if we're at the trigger point of needing to make further recommendations to dial things down. You know, it's primarily based upon the rate of hospitalizations, the new admissions. But we also realize that right now the pinch point seems to be our ICU capacity. So we're looking at models related to ICU capacity and whether or not we're within 2 or 3 weeks of exceeding that capacity. If that's the case, then we'll need to make the decision to have further restrictions. Again, you know, our major goal here is to avoid overwhelming the healthcare system. We really want to avoid having to use alternate sites of care for victims of COVID-19. And you know, if we're at that trigger point, then we expect that decision to be made in the next 24 hours. But again, there are other factors that go into that, including the hospital capacity, ICU capacity, the doubling time of cases, the doubling time of the increases in the hospitalizations. And so there are a number of things to consider before making that decision.
Okay, thank you. Our next question from KXAN is, the past few days indicate that there has been a decline of confirmed new COVID-19 cases in our area. How significantly do you believe a lag in testing is impacting this number? Is there a chance those numbers could be retroactively updated and significantly change from what we see on the dashboard now?
So there's 2 things on the dashboard that tell 2 different parts of the story. The new cases dashboard shows when those cases were received and reported to Austin Public Health. The epi curve is when the disease onset happened. And that will be refreshed, so you will be able to see when the disease onset happened. And you know, going back, we can see that, you know, when we had the initial reopening of 25% phase 1, and we looked 2 weeks later, there wasn't much of an impact in the new cases. But the 2 weeks between phase 2 and you know, which was around the middle of May, and June 1st, there was a significant increase. And that reflects to us that perhaps opening to 50% is too much. So right now, I think we're in a better spot if we dial things down back to 25% occupancy so that we can slow the curve, we can decrease the activity in the community without dialing off completely. And you know, those are the kind of recommendations that we'll be able to make after the meeting this afternoon.
All right, great. Next from Community Impact. As hospitalizations rise and leaders make surge plans, local hospital capacity is a crucial piece of information for the community right now to understand the situation we face. Understanding this is a difficult number to pin down due to ever-changing staffing numbers, is APH any closer to providing capacity on its dashboard?
So we are working with our partner at the Capital Area Texas Regional Advisory Council, who manages the data of that nature. So as Austin Public Health, we're not legally entitled to information about all hospitalized individuals and all hospital beds. We're only entitled to information related to those with infectious diseases. But we do have a partner at CATRAC who can track that data, and we expect that within the next week, hopefully by the end of the week, they will be able to share that data so that we can have some real-time idea about where we are in terms of capacity.
Okay, thank you. From Fox 7, we have a question that says, is there any indication we will need to utilize the convention center beds?
So again, the convention center beds, our alternate care site, is meant to be a buffer. So if we miss the mark, if we overshoot and we exceed capacity, then that's where the extra capacity can go. The alternate care site is designed to take care of low acuity patients. So these may be patients in a non-monitored hospital bed that may need a little bit of oxygen, but not much else care. Those are the kind of patients we could shift from the hospitals to the convention center that can be supervised and managed relatively easily, so that the hospitals have additional capacity and space to take care of those who are more significantly impacted. We have to appreciate that as ICU capacity decreases, the hospitals have to transition non-ICU beds into ICU beds, which will cut down on their capacity to take care of those non-critical care patients, which may hasten the need for the use of the alternate care site. Again, we expect that site will be ready to go on July the 20th, and certainly we are hopeful that we don't have to use it.
All right. From CBS Austin, they say Austin is holding off going to stage 5, even though the criteria for new hospital admissions has been met. After a drop to 247 new cases on Monday, the case count went back up yesterday to 482. Is that enough of a downward trajectory to keep us in stage 4? Did Tuesday's numbers reflect a delay in the holiday weekend count like we saw in some parts of the state?
So I think that the holiday weekend did account for a decrease in cases that we received. But even before that, we had a decrease in cases on Friday as well. Again, it's too early to tell, and we'll be looking at the data from today as well as the updated models to suggest if it's time to transition to the stage 5. If you recall, there's a transition between 70 and 123 regarding that movement to stage 5. That depends on the trajectory, and that's the assessment that's going to happen today to determine if we need to make that transition.
I'd like to add with Dr. Escott's assessment. When we typically look at the data that we are receiving, we also like to consult with our partners. Today at noon, we are going to review that data and have conversations with our hospital administration staff, our elected officials, as well as our Emergency Operations Center staff. And so we make those decisions, we look at the data, we make a decision, and we provide our information. But collaboratively, we come to the response of moving to the next level. And so that way, as we've moved through, the success of our response to COVID-19 has been much more beneficial with the use of partners. And as Dr. Escott stated earlier, we'll have the UT modeling team on the phone as well, and they will be able to provide based upon the modeling that they have present for us. So that is how we typically make our decisions to move to the next stage.
Okay, thanks to the both of you there. So next from KUT, they're asking, what is the current level of preparedness of the Convention Center Field Hospital, and what resources are still needed?
I don't have the current update on where we are today. The teams are in the process of executing contracts and the build-out process, but we're happy to have somebody later this week provide an update on where they are on that. Again, the pinch point for the hospitals for alternate care sites, not only in Austin, but in San Antonio and Houston as well, is the personnel issue. And I know that there is recruiting efforts going on nationwide to pull people, physicians, nurses, respiratory therapists into Texas to help. That includes the United States military, it includes civilians. This is the time in our surge where we need the support from the rest of the country who may not be as significantly impacted as Texas is right now to help us. We saw a number of nurses and physicians from Texas going to New York when they were facing surge, and I think we are stronger as a country if we're working together to support one another during their periods of surge.
Okay, thanks. This is going to be the last question. It's from me at the Chronicle. So Mayor Adler has talked about the possible need for a 35-day shutdown to kind of slow transmission of the virus. And if either of you could kind of talk about what that would actually look like what types of businesses would close, what would remain open, and then what's the current thinking on the legality of mayors or county judges issuing an order like that? Would y'all be able, or would they be able to actually enforce that order under the governor's current executive order?
So my hope is that this would be a dialogue with the state. I think Governor Abbott has been very reasonable in terms of listening to the data and listening to the recommendations of the local city and county officials for the jurisdictions that are being heavily impacted right now. I don't think the governor wants to see people unnecessarily die, and I'm hopeful that partnership will continue, and that if we make the recommendation that we need to dial things down further or dial some things off, that will be a productive dialogue. We are looking at different options for turning things down a bit more that we can legally do within the governor's executive order. Part of that discussion will happen tomorrow at City Council, but it's up to all of us. We don't necessarily need to turn things off for people to stop going to those places. If you remember back when we had right before the shelter in place, we were advising people not to go into restaurants to do takeaway and delivery only. We can do that now. Folks can choose to not go into restaurants and to do takeaway and delivery. They can choose not to go into retail stores and do takeaway and delivery of retail items. We don't necessarily need to turn things off if we as a community decide to turn things down on our own and take action to prevent further spread. None of us, including Director Hayden and I, want to make the recommendation to go back to a shelter in place. We know that it hurts people. We know that it threatens people's employment. We know it threatens the economy. And we want to find that balance between a healthy economy and the health of the community. And that's why we're pleading with people today to make the choice to dial things down on their own, to act in a more protective way so that we do not have to face that decision of making the recommendation to go back to a shelter in place.
All right. Well, before we wrap up, would you, Dr. Escott or Director Stephanie Hayden, like to give any closing remarks?
We cannot emphasize the importance of staying home. We would like for as in this world of social media, and as so many people are coming up with so many new traditions, we're wanting us to go back before there were orders in place for us to only go out when it's absolutely necessary. And in those instances, we came up with what I'm going to call a new normal. And within that, a new normal, we found ways of how do we ensure their activities for my child? How do we ensure that I am continuing to do things safely and make sure my basic needs are met? We are wanting individuals to voluntarily look at how much more you are going outside of your home, how much more you are spending time with people that don't live with you now, and go back 3 months ago and think about how much you have increased your activity outside of your home. We want you to go back to those days. We want you to voluntarily make that decision to stay home and think about that time. The thing that we know from just having conversations with people just, across our area and other areas, this has allowed us some time to do things that we were not able to do at home in our individual life and in our individual space. So it's so important for us to just voluntarily take a look at what you're doing and how much you're getting out and decrease those efforts. Please check on your loved ones and always keep in mind you can receive mental health services and behavioral health services. Those services are so important. And please check our website later this afternoon, and we will have a document for response and a survey for the Latinx community. Thank you very much.
Let me close by saying, back in March and April, we spoke about needing to decrease our activity by 95%. So if right now you are interacting with 10 people a day outside of your household, we need you to decrease that to one person, so that we can get a handle on this. We can put the lid back on this disease transmission, and we can be in a healthier place in terms of public health and our economy. Now is really not the time to get together with family and friends. It's not the time to have baby showers and bachelorette parties. Now's not the time in Texas. We have to be serious about this. And I know there's conflicting messages, political messages. There is no conflict in public health. There is no conflict with healthcare providers who are paying attention to the data. We've all been very, very clear. We are in a very dangerous situation in the state of Texas, and we join many other states who are in a very dangerous situation right now. We simply must be careful, because we are at the verge of a real crisis in Texas. Now's the time to act. Now's the time to protect yourselves and your family and your community by staying home.
All right, that concludes our media availability for today. Thank you to APH Director Stephanie Hayden, Dr. Mark Escott, and the pool reporter for joining us today. Thank you, everyone.